So I'm now going to introduce the first speaker, who needs very little introduction. It's my pleasure to invite Helen Morement, CEO, human dynamo, a leader extraordinaire, an amazing person. And I could go on, but I won't. I'll let her speak for herself. So Helen, CEO of AMMF, please come up and give us the opening talk.
Well, thank you very much, Shahid. I feel quite embarrassed now. Thank you. So you know who I am. I'm Helen Morement, CEO at AMMF. And what I'm going to talk about is exactly what's there, how AMMF works for the cholangiocarcinoma patient. Well, back in 2002, at its inception, AMMF was the world's first charity dedicated solely to cholangiocarcinoma. And today, 22 years later, we remain the UK's only cholangiocarcinoma charity. We now work nationally across Europe, and we collaborate globally. Back in 2002, we began with 3 aims: to raise the awareness of cholangiocarcinoma, to provide information and support, and to encourage and fund research. And to this day, those aims remain the cornerstone of all that we do. So today I'm going to talk about AMMF's work around the first 2 of those aims. But first, in a day in which the focus of every presentation will be cholangiocarcinoma, I'll give you a brief overview of what this cancer is and some of what we believe are the important facts. Well, cholangiocarcinoma is one of the biliary tract cancers. The others are gallbladder cancer and ampullary cancer. Cholangiocarcinoma has 3 anatomical variations, and it's also known as bile duct cancer. The 3 subtypes are intrahepatic, and that's when the cancer happens in the ducts inside the liver; hilar or perihilar, when it happens at the confluence of the main ducts as they join together, leaving the liver and become the common bile duct, which goes down to join the intestines. And this is believed to be the most commonly occurring type. And then we've got the extrahepatic or distal cholangiocarcinoma, which happens anywhere along that common bile duct from the cystic duct down. Now, AMMF's work is totally cholangiocarcinoma focused, and improving the future for those with this cancer is always at the heart of everything we do. We know a diagnosis of cholangiocarcinoma leaves many patients and their loved ones feeling the future is very uncertain. And when they contact AMMF, they're confused, feeling isolated and helpless, and they are afraid. Many patients receive their diagnosis in a non-hepatobiliary specialist hospital and are told there's nothing that can be done for them. This can mean possibly missing the window of opportunity for surgery, which is currently the only potentially curative treatment there is, and not being given the opportunity of molecular profiling, which could open the door to targeted therapies, immunotherapy, and the clinical trials they might be eligible for. So what does AMMF do to support them and help them find the information they so badly need? Well, one of the ways is with our websites. AMMF's main website is comprehensive, with information on every aspect of cholangiocarcinoma, including clinical trials currently open and recruiting in the UK. It's clear to navigate and continually being updated. Now, our main website is geared to the UK, but AMMF is committed to supporting not only those in the UK, but also European patients through greater access to the information, resources, and support they need. So we now have a European website. It's currently available in 8 languages, with more to come. And we're daily users of social media. These platforms are important tools, not only for sharing information and news, but also for raising awareness, reaching out as they do to thousands across the world on the news feeds. And we also have private discussion groups focused on those in the UK and Europe, but used by people from all over the globe. These groups, moderated by those with first-hand experience of cholangiocarcinoma, provide enormous support to those working their way through the many difficulties and challenges they're faced with. All patients should have easy access to reliable information, and of course, we live in an internet world. So we have a patient support button on our website's main navigation bar, so that from there, with as few clicks as possible, all the information needed can be found, including a growing number of informative resources, which are available in hard copy if required, or simply to download. With the rise in the incidence of cholangiocarcinoma and the advent of targeted therapies in its management, molecular profiling is becoming increasingly important. Certainly, the approval of targeted therapies in the UK and Europe should have opened the door to molecular profiling for all with cholangiocarcinoma. But patients need to know about this, and in the most timely way possible, so they don't miss out on any treatment or clinical trial opportunity that might be suitable for them, and which, although not curative, may extend their lives. So our resources now include an informative booklet on molecular profiling and a video available in several European languages, and these are available for patients and for healthcare professionals too. And currently we supply all our resources to our growing UK network of clinical nurse specialists. And we're delighted to have held a clinical nurse specialist workshop here yesterday, and we have a number of those nurses with us still today. So with the rise in the incidence of cholangiocarcinoma and the advent of new therapies in first and second line, after many years of very limited treatments, there's now a greater need for cholangiocarcinoma information to help support pan-cancer organisations and healthcare professionals, not only in the UK, but across Europe. And so we've now produced patient organisation education materials, which are available in 3 ways. A comprehensive guide, which is fully referenced, fast fact summary, and a companion PowerPoint slide deck. And these are currently being translated, or have been translated, into 4 European languages, will be available to download from AMMF's website, and are actually, and we have some hard copy here today if anybody wants a copy of that. But over the years, we've come to realize that a key barrier to improvements in the cholangiocarcinoma landscape has been the lack of robust data to back up the lived experiences we were witnessing, the rising incidence, the significant variation in diagnosis and treatment. Early diagnosis and survival rates were not improving, and in fact they are considerably worse than for other cancers. And also very worryingly, and contrary to existing data, we were seeing more younger people being diagnosed and losing their lives. So that's why back in 2018, AMMF commissioned and funded a first-of-its-kind cholangiocarcinoma data project from within Public Health England and later with Health Data Insight in collaboration with partners at Imperial College London. Data from some 50,000 patients with the biliary tract cancers between 2001 and 2018 were used, and the data project finally completed last year, and the findings were presented at our conference this time last year. And to paraphrase Donald Rumsfeld, these findings confirmed what we knew, but they also uncovered some of what we didn't know. So confirming what we already knew, but now we've got the data to support, is that incidence is increasing year on year. Cholangiocarcinoma is a growing untargeted problem. More younger people are affected. Over 20% of patients were under 65 years old when diagnosed, and survival rate is appalling. Mortality is parallel to incidence. And some of the very concerning facts that we weren't aware of include over half of cholangiocarcinoma patients receive none of the treatments currently available for this cancer. No surgery, no stenting, no chemotherapy. And there's geographical variation in routes to diagnosis and treatment, and also in incidence. So this substantial body of work has resulted in 3 papers, all now published. So we finally have the robust published data to support what we have long been seeing. And then, last year, the NHS, our National Health Service, also published data on liver cancer, which appeared, as I say, coincidentally at the same time as the results of our work. And this clearly shows that in 2020, the incidence of cholangiocarcinoma is more or less equal to that of hepatocellular carcinoma. So HCC at 2792 and cholangio at 2706. Yet, whenever liver cancer is mentioned, despite the fact that cholangio is a primary liver cancer too, it's usually only HCC that's being referred to. And HCC gets the lion's share of attention in just about every area. And health outcomes for those with cholangiocarcinoma currently lag well behind. So AMMF launched its Rethink Liver Cancer campaign, asking that we stop thinking of liver cancer as only hepatocellular carcinoma, but to fully recognize cholangiocarcinoma as a primary liver cancer too, and to raise public and professional awareness of cholangiocarcinoma regionally and nationally, and particularly within the planning of health policy. We've also produced a white paper. And this includes a series of evidence-based recommendations, and we hope this will reach those who have the power, the influence, and the will to change policy, to ensure that cholangiocarcinoma is better recognized and addressed, to enable earlier diagnosis, increase access to treatments, and reduce inequality. So as part of the ongoing campaign, AMMF held a reception in the House of Commons, Westminster, during February's Cholangiocarcinoma Awareness Month. And at this event, which was hosted by Elliot Colburn, elected Member of Parliament and chair of the All-Party Parliamentary Group on Cancer, we promoted the white paper and its asks to many of those within government, the health service who have the power to make change, raise awareness, and ensure that those with this devastating cancer receive better and more equitable care than they do currently. Now, what I'm going to do next is to share with you a short video we showed at our Westminster reception, which explains our new data. And in this, you will also hear the patient's perspective from some of those diagnosed with cholangiocarcinoma and what they are now asking for.
I was given months to live and told to put my affairs in order. Being told you're going to die can become a self-fulfilling prophecy. The impact on a person's mental and then physical health is appalling.
I wasted valuable time battling to get my voice heard by those who said that nothing could be done. When there was hope for me, they just didn't know how to treat me.
Nobody should die because of a lack of knowledge or awareness. It's not fair. People are dying needlessly.
Cholangiocarcinoma is a primary liver cancer with some of the worst early diagnosis, treatment, and survival rates of any cancer. Case numbers are rising. It's affecting more younger people than previously thought. And worryingly, our research also shows that more than 50% of NHS patients are not given any of the available treatments for this cancer. Something has to change, and with the help of everyone who can move the dial on action, there is much to be hopeful for. Thanks to targeted molecular therapy, patients have now been able to access new treatments and live years beyond their initial prognosis. But for treatment to be effective, people need to know about and be able to access the available treatments. Why are half of cholangiocarcinoma patients not given any cancer-specific treatment at all? The disease also has to be caught early, and this only happens in 1 in 5 cases. That's just 20%, compared with 54% for other cancers, and the NHS ambition for 75% of all cancers to be diagnosed early. AMMF is committed to raising awareness at all levels and supporting research to stop this cancer being missed, misdiagnosed, and managed too late. Our 4-year study, using data from over 50,000 patients within the NHS in England, gives policy planners and healthcare practitioners the tools they need to commit with confidence to meaningful action for people with cholangiocarcinoma, and a more equal playing field around earlier diagnosis and access to treatments, in line with trends for people with other cancers.
I was lucky to find treatment options I would otherwise never have known about, but it shouldn't be up to patients to have to work out how to do this themselves. All cholangiocarcinoma patients should be offered the opportunity to be seen by an appropriate specialist as part of a standardised diagnosis process.
It's important we all work together for better and fairer health outcomes. Who you are and where you live should not affect your chances of living with and surviving a cholangiocarcinoma diagnosis.
Today I can live a fairly normal life. I know it could return at any time, but for now, 5 years after being told I had months to live, that's okay. Because months make all the difference between potentially life-saving surgery or dying, I really urge everyone to rethink liver cancer today. Raising widespread awareness of cholangiocarcinoma will see more people being diagnosed earlier and more lives being saved.
So I'd really like to thank Andrea, Judith, and Andy for their courage. They're so brave in doing what they do, in taking part in the making of this video and sharing what, to me, are vitally important messages we all need to take away. So we may have come a long way in that we now have that cold, hard data, that robust data we have needed for so long. But unfortunately, the widely held perception of cholangiocarcinoma being a cancer of low incidence continues. And with it, the lack of awareness, which leads to many people not getting the care that they should have. So at AMMF, the work towards changing and improving what is happening every day goes on. At AMMF, we know that far too many cholangiocarcinoma patients are not referred to knowledgeable specialists and are not under the care of those centres with the knowledge and experience to give everyone the fairest chance. Our overarching aim is to ensure that each cholangiocarcinoma patient is confident that their treatment pathway is correct and that they're receiving the best possible advice and care. There are the recently published BSG guidelines for the diagnosis and treatment of cholangiocarcinoma, and you'll hear about these today. But we need to make sure these are disseminated much more widely to ensure equity. We'd like to see all patients referred to a specialist multidisciplinary team, and ideally, they should be cared for in centres of cholangiocarcinoma expertise. So following discussions going back over several years with a number of concerned specialists, we've now embarked on a project to put together a case for centres of expertise. And you're going to hear more about that later today. And we know it's very early days for that one, and there's a long way to go. But we're going to give it our very best shot. Thank you.